Endometriosis affects around 2 million women in the UK, with most diagnosed between the ages of 25 and 40.
In British Asian communities, however, many women are thought to be going untreated because of stigmas around discussing periods. Emma Snow has been to meet some of those who are trying to change that.
Lioness Leah Williamson, Love Island's Molly May and broadcaster Emma Barnett have brought endometriosis into the spotlight. The condition causes debilitating period pain, bloating, nausea, fatigue and infertility, to name just a few. And according to the charity Endometriosis UK, it takes around 8 years to get diagnosed.
Lots of trips to the doctors, lots of trips to A&E, to hospital, having tests, swabs.
It took Rada around 6 years to get diagnosed, and she feels that there's still a lack of understanding from some medical professionals about the condition.
I've been doubted. It has a huge toll on your mental health as well. You know, I got very, very depressed at one point. It got to a point where I had to quit my job. I had to move home, you know, because I couldn't afford rent, and it's really isolating.
In Asian communities, talking about your period is still deemed to be a taboo topic, which is just another of the many barriers some women face whilst trying to get a diagnosis.
No one wants to come forward, no one wants to talk about it. And I want to break that barrier. I want to break that taboo.
What a lot of people struggle to understand is that endometriosis is so much more than period pain. It can be completely life-altering.
It's impacted my work, it's impacted my relationship, it's impacted the ability to have children. It destroyed my life.
From struggling to get a diagnosis to the cultural barriers and then the life-altering symptoms, these women are fighting for more research into a condition that can't be cured. Emma Snow, BBC News.
Well, let's speak now to the GP, Dr Nighat Arif, who's in Chesham. Thank you so much for joining us this morning, Doctor. It's good to see you. Now, this is it's a very difficult thing, isn't it, to diagnose, and really tricky in terms of a challenge for more marginalised communities, in terms of those that don't necessarily discuss women's health so openly.
Well, that's a lot of my life's work. If we look at endometriosis, which are cells similar to the lining of the womb, which are deposited outside in the pelvis onto fallopian tubes, ovary tubes, bowel, bladder, and now we know you can get endometriotic tissue even in lungs. I mean, this is a chronic disease which is debilitating, causes painful periods, even sometimes heavy periods. It can also cause bowel and gut symptoms as well. It can cause painful sex and also infertility issues for those who suffer from endometriosis. What happens with ethnic minority communities is that things like talking about your periods or your vulva or your vagina, these are hypersexualized organs that you're talking about. And so it's easier to ignore or not talk about it because there's so much shame and stigma attached to it. And also there aren't the right words as well. In my community, I'm Pakistani, the words that we use for, say, vulva or vagina or just normal genitalia like breast as well, we don't have the ones that directly translate. They're derogatory or even swear words. So women are embarrassed to use that, and so everything remains under the veil, and that means that symptoms aren't discussed openly. And so even if you do not have the lexicon, how do you go to the doctor to explain to them that you might have endometriosis?
Gosh, that's absolutely fascinating. So there isn't actually even a direct translation. So therefore, what advice would you give to people who are listening to this, thinking perhaps that's me, perhaps I need to go speak to a doctor? They might suspect that they have the condition or someone they know does. How do you start talking about this?
The first thing is to do that within your own community with those around you without stigma or taboo or shame. And then keep a diary of your symptoms as well. There are lots of charity groups, Sisters, Endometriosis UK, Wellbeing of Women, who are doing so much work with ethnic minority communities. I make content on TikTok on endometriosis and translate that into Punjabi for those who don't speak English as their first language. And I think we've got to be starting reaching out to community centres, places of faith as well, to say that talking about periods is not a shameful thing. We do have an idea within the community that actually keeping this under the veil is somehow more respectful for a woman, but what it means, it delays the diagnosis. Currently, the diagnosis for endometriosis is about 7 to 8 years, and we know 1 in 10 women suffer from endometriosis. And this is something that also is associated with other chronic conditions like migraines, bowel dysfunction, irritable bowel syndrome. You can even get sort of recurrent urinary tract infection, and also impact your choices of whether you want to have children or not. And so it is something that we need to be able to have that conversation openly.
We do. What kind of treatment is available for this? Because as you described, there are lots of symptoms there, some of them very painful, but I understand there's some development in this field going on, new trials.
There are some new trials. So firstly, there are simple pain relief that you can have over the counter, but the most important thing is you go on to your doctor, because the diagnosis isn't made on an ultrasound scan, it's made by laparoscopy, which is surgery, which isn't something that everybody can have. So this is a disease that doesn't have a diagnosis as such that even a GP can make in the surgery. So it's quite a complex pathway. So this is where research has come in to its own, because at the moment the current treatment plans are pain relief like paracetamol, ibuprofen, mefenamic acid, tranexamic acid, or even sometimes codeine for our patients. And then it's hormonal treatments such as long-acting reversible contraceptives. That could be the implant, the depot injection, or the Mirena coil, or the pill. So that could be the combined oral contraceptive pill or the progesterone-only pill. But research has now gone into greater sorry, I do apologise. Research has now gone into greater research. So dichloroacetate is the first treatment, which is going to be looking at non-hormonal treatments as well. We're looking at holistic things like acupuncture and yoga and exercise having an impact. Nutrition, there's loads of research going into that and how that can help women. So it is incredible. And the dichloroacetate trial, which is a non-hormonal treatment, should hopefully reduce the reduction of the endometriotic lesions